name's Lily. I'm being a nurse today and I'll be doing a sterile dressing change and wound culture. First, I would start by gathering all of my supplies, my clean gloves, my sterile gloves, my culture swab, and then also my dressing change tray. Then I would go into the patient's room. I'd ask for name, date of birth, my 2 identifiers. I would ask if they have any allergies and if they are in any pain. If not, then I would put on my clean gloves. After washing my hands, they don't have to be sterile due to it being an old bandage. I would then remove the bandage. I would assess for any drainage, what color drainage it is, any odors coming from it, and then dispose of that into my biohazard bag. I would then assess the wound for any skin irritation, redness, excessive draining in certain spots, and then also odor coming from that as well. Then remove my non-sterile gloves. I would then open my dressing change tray, being careful not to touch anything in the inside. I would then take my sterile field out, and then after cleaning the counter that I'm using, I would place the sterile dressing or sterile field. Then I would take my culture swab, I would open it, and I would drop it about 6 inches. From the sterile field on top, being sure to be within that radius. I would dispose of that into my biohazard bag, and then I could start putting on my sterile gloves. Be careful not to touch the inside of the gloves due to your hands not being as sterile as the gloves. And then with the sterile glove on, you can take the other glove underneath. Do not touch the inside of the glove to it not being sterile. And once that is on, okay. Then taking my non-dominant hand, I would start grabbing my tweezers, my swabs. They are open, so I'll put them on top of the tweezers so they do not spill all over the sterile field. And then take my tape. It does not have to be sterile, so it can be placed in that 1 inch margin. I would then take my gauze and then also my bandage. Now that all of those are placed, I can begin by taking my swabs, clean down the middle, and dispose of that. Clean the side, dispose of that, and clean the opposite side and dispose of that. And then can take my gauze, tweezers, and I can pat down the incision and drop my gauze. And take the rest of the gauze and clean the same way that I did and drop those into my biohazard bag. And then we'll take my culture, we'll take the top off, dispose of that. Then I would take my culture swab and I would swab a 1 centimeter margin in one of the open spots of the incision. And be sure not to touch the outside of the swab container. And I can place that on the counter. It does not have to go back on the sterile field. Then I would take my bandage or my new dressing and apply that on top. And once that dressing is applied, you do not have to be sterile anymore. And then you would begin to tape it up. After it is taped, I will go ahead and remove my gloves. After it is taped, I would then take another piece of tape and write the date, the time, and then my initials And then on the culture swab, I would write the patient's name, date of birth, the date today, where the culture had came from off the wound, and then also the time and my initials. And then I would report and record all of my documentation, and I would evaluate the patient if they have any pain afterwards, and then dispose of all of my sterile stuff.